Bismillah ar-Rahman ar-Rahim. This patient was a 30-year-old female patient that had a coronary artery stenosis, and she went for diagnostic coronary angiography, transfemoral diagnostic coronary angiography. And after the procedure, there was progressive swelling at the left groin, there was discoloration of the skin, and this was an indication for ultrasound and Doppler exam. We found that we have large pseudoaneurysm originating from the most proximal SFA with a relatively narrow neck that measured about 4 millimeters, but the sac itself was large, reaching about 7 centimeters in maximal dimension. It had typical color flow of pseudoaneurysm. It had typical pulsed wave appearance, and we suggested that the optimal treatment for such case is to be human thrombin injection and not ultrasound guided compression. Why? Because it's a very large pseudoaneurysm. It's larger than 2 centimeters in maximum diameter. It had a narrow neck. It's more or less separate from the parent artery, and there was no AV fistula concomitant with the lesion we have. So the optimal treatment was to perform ultrasound guided human thrombin injection. So we asked for this, but we don't have human thrombin now available in the market, so we had to perform the alternative, that is the mechanical compression using ultrasound guidance, and unfortunately it was not successful. It was the same size after ultrasound guided compression for about 60 minutes. No evidence of mural thrombosis, and this was expected from the beginning, but because there is a high failure incidence for ultrasound guided compression for a case that is on double antiplatelet treatment with and also with a large size of a pseudoaneurysm. We have performed similar cases before with mechanical compression using ultrasound guidance, and some of them were successful, but the other part of these cases was not successful, and in this case the optimal treatment was human thrombin injection. It's a typical pseudoaneurysm for human thrombin injection because it's a very large size, it has a narrow neck, it's separate from the parent artery, and with no concomitant AV fistula. So we had performed this procedure, then it failed. We suggested that the patient, the physician or the resident of the case, to perform manual compression for half an hour every 3 to 4 hours for 24 hours, the next 24 hours, with of course application of the bandage around the groin, but it also at the follow-up was the same picture with the same size, with no evidence of thrombosis inside. So the vascular surgeons had to intervene and do operative correction of the pseudoaneurysm, and it was successful. So what we learned from this case, we learned that the mechanical our mechanical compressions, either it's manual or it's applied by ultrasound guidance, in such cases with a large pseudoaneurysm that is more than 2 centimeters in maximum diameter, we expect that these cases we may have failure that reaches more than 40 or 45% of the cases, and this is the optimum treatment for such cases is human thrombin injection if it's available. But if it's not available, so we have the other option to do mechanical compression, or we can go through transcatheter occlusion, but it also was not available for this case. So the vascular surgeons, they decided to go for performance of operative treatment. Thank you.